Miss Honorata, can you explain what means FGM, female genital mutilation in general? What we are talking about?
Okay, female genital mutilation refers to the cutting of external genital part of a girl or a woman by removing and throw it. It's a cutting of a female organ, means cutting of clitoris and cutting of labias.
Why is it done? What are the social or the traditional backgrounds?
Yeah, it's different from one tribe to another, but mostly it's traditional reasons. They cut it because it's their culture and beliefs. Very few people relate FGM and religious issues, that it's written in the Quran, which is, when you talk to the Shia Imams, they say it's not written in the Quran, but mostly it's because of the culture and tradition. And when you talk about the culture, it differs from one tribe to another. People believe that uncircumcised girl will become a prostitute. Some people believe that when a girl must be virgin before get married, so by mutilating her, she will remain without sleeping till the time she gets married. Another people believe that they cure the disease called lawalawa. Lawalawa means it's a fungal infection, but lawalawa is a Swahili name, but it's a fungal infection caused by itching of the genital area. The baby girl itched herself. This fungal infection caused by the dirty, that the shortage of water, some people do not wash their babies, so they get this itching. So they believe the clitoris causes lawalawa, so they cut the clitoris in order to cure the disease. There are some people believe that uncircumcised girl will not deliver her baby normal, because clitoris will touch the head of the baby and the baby will die. There are also people believe during sexual intercourse, uncircumcised girl, she's very powerful, so can kill a man. Those are the beliefs. They also believe that if you are not circumcised, you are not part of a woman. You are still a child. You are not accepted by other women. So you have to be cut in order to move from childhood to adulthood.
Thank you for explaining. Can you explain the effects of FGM too? What are the effects in a social way, in a material way, but also for body and soul of girls and women who are circumcised?
When you are talking about health consequence of female genital mutilation, we talk about short-term and long-term effect. When you talk about short-term, it's during the cut. Remember, there is no anesthesia. So it's extreme pain and bleeding. People bleeding a lot. Girls are bleeding, and some people died because of this bleeding. Another short term is a trauma, social, psychological problem because of the torture they go through during the cut. When you talk about long term, it's bring difficulty during childbirth because the genital parts are elastic. But when you cut, you form a scar. That scar is not elastic anymore. So during childbirth, it's very painful because the head of the baby is not easy to pass it through. When you talk about those long term, is trauma. Every time you feel that men are not good during sexual intercourse because of the pain. Also, there is infection. Can be infection in urethra, can be infection in the womb and everywhere because of the dirty tools and the environment of the place where operation has been taken.
Could you explain, please, the different types of FGM? You brought us a pelvic model, and I think it's very good to show the different types.
Okay. This is our pelvic model, which we used to help to educate our community, because most of the women did not know about their parts. So we show this model in order to explain first what is the part and the importance of this part. We have clitoris and we have labias. So this is the normal genital part of woman. When we talk about the types, type 1 is suna. Suna means the cutting of the clitoris, or the whole clitoris, of the part of the clitoris, like this. When you compare the original parts and this one, you see the clitoris is shorter than this one. So this is suna. The second type of FGM is excision, the cutting and removing of all clitoris on all labia minora. So it's the shape of a woman. She's going to look like this and not like this. This is called excision. The third type is called infibulation. After doing excision like this, they take the labia majora and stitch together, and just leave the small hole like this for urine and menstrual blood. We have the type 4 of FGM, which is not called FGM. It's called FGP, female genital pulling. We don't have the model, but it's by using traditional herbs, they make this clitoris long. Every time your mother put these traditional herbs and start to pull out your clitoris till it become long or more than a penis, and this majora become also very big. So this is also type 4 of female genital mutilation, but it's called female genital pulling, FGP.
Thank you very much. Last question. What makes you optimistic to stop female genital mutilation in Tanzania? It seems to be a long way.
Yeah, it's a long way, but we believe through education, through sensitization and awareness creation, through empowering girls and women, will stop FGM. Because we believe our fellow societies with practice, they did it because they believe it's something good. The mother believed that we have the duty to protect our culture by cutting and allow our girls to get married. But we want to tell them through education, through taking your daughter to school, it's a good point to make a better life for your daughter without cut. So through education, we believe we can reach the point because we have a lot of success by education.
Miss Honorata, thank you for this very interesting interview, and all the best for you.
Thank you.